This conference will now be recorded.
Thank you for watching the 2020 Housing Inventory Count Survey Training, or the HIck training. My name is Max Burns, and I will go through the slide deck to explain the new 2020 HIck survey that will be implemented on January 23rd and will close on January 27th at 5 p.m. Today's webinar will have 3 learning objectives. So 1, understand the housing inventory count and process, learn about the new HIck survey and what's different, and all participants or viewers should understand and then be able to actually complete the HIck survey for each program or project that their agency has. So this is a quick agenda and overview. So the HIck history and purpose, what's new with the process and the survey itself for 2020, the due date, helpful tips, and then additional resources and contact information. So the context, history, and purpose of the actual housing inventory count. These are some basic acronyms that some of you may be familiar with. So the housing inventory count, or HIC. Here locally in Chicago, we've been implementing what's known as the pre-housing inventory count, or pre-HIC recently. The HIC goes along with the point in time count, which is the complete canvas of the city of Chicago on one night in January each year. It's required by the Department of Housing and Urban Development, or HUD, for all continuums of care to participate in, at least biannually, but we conduct it annually here in the city. All of this data is then collected and analyzed and submitted into the Homeless Data Exchange, or HDX, which is a application or website run by HUD. And if you are not familiar with the continuum of care, or the COC here in the Chicago area, feel free to visit allchicago.org for more additional information. So the history is that the HIC, well, I previewed this a little bit in the last slide, but it's conducted annually every year. The housing inventory count is. It is in conjunction with the point in time count, as I said, and it always takes place within the last 10 days of January. The major reason that this is done is to provide a snapshot across the nation about homelessness, both for folks experiencing homelessness out on the streets or unsheltered, as well as folks who are in programs who are in shelter. These two processes feed into what's known as the AHAR, the Annual Homeless Assessment Report, which is a federally mandated, or yes, a federally mandated report that is sent to Congress on behalf of HUD. This is used to identify funding amounts for the continuum of care, or to HUD for the issue of homelessness prevention and response. Another reason this is very important, or the HIC is really important, is the inventory that is utilized, or is it's utilized for coordinated entry. So there are specific units and beds that are used for coordinated entry that are captured and tallied or counted effectively through the HIC process. Both processes, the HIC and the PIT, are a part of the larger continuum of care application that the city applies for, that supports roughly 150 projects across 43 or 44 agencies in the city, and is roughly $70 million annually and continues to grow. And then locally, what's really important for us is that this annual process helps us make data-informed decisions on how to best address the issue of homelessness in the city of Chicago. A quick note about definitions. So for this webinar and for this process, we use federally defined definitions for beds and units from HUD. Those are on your screen. So a bed is a piece of furniture used for sleep, typically a framework with a mattress, so like a frame, in other words. And then a unit is intended to be considered as a separate living quarter. A single room can be seen as a separate living quarter or an apartment. To further explain what a unit is by HUD's definition, if you have an emergency shelter that is perhaps 2 floors of congregate or dorm style living with beds on each level, the program itself could say that they have 2 units with an X number of beds across or between both of those floors for their project's inventory. So to dig deeper into what is new with the housing inventory count, or HIC, for 2020, we broke the process up effectively into 2 parts, and we did this for 3 reasons. 1, to improve the accuracy of HMIS inventory data. 2, our office is attempting or is working really hard to reduce the workload for this process. In the future, we're hoping to move the housing inventory count more towards an HMIS reporting method, where we will run a simple report and then ask projects to confirm if that's accurate or not. This is what the sheltered pit process is starting to look like. So we're trying to mimic that. And then overall, this work will help us improve our reporting to HUD. Projects often ask why they should complete or comply with the HIC, and the simple answer is that it allows us as a city to present a much clearer and much more defined example or picture, of what our inventory is, and then we can compare that with the number of folks that are unsheltered and say, we have this many beds and units that are being used, and we need this many more to help folks because we know that they're out on the streets, unsheltered. So by all projects, regardless of funding, participating in the HIC process, it helps the entire system gain resources and helps us make a better argument to be awarded more resources by HUD. So the first major change for the HIC this year has already occurred, which was on the pre-HIC phase in November. Historically, we have asked for all of the data elements that you see on the screen below. So the project information and type, your project's target populations, the number of units and beds, whether those be funded by your contract or if you have overcapacity beds or units. We've also asked emergency shelters for their bed types and specific questions for that project model type. And then we've also asked if a project has HMIS participating beds and units. We've asked all of these questions or questions related to these data elements already, when previously we would ask all of these data elements or questions about these data elements, and we would also ask for questions about these data elements as well. The unit occupancy and bed occupancy, the number of beds that are dedicated to specific individuals or population types, and what types of changes are occurring or happening in your inventory. We would ask for all 10 or 11 of these different data elements in one survey. And in this year, we're breaking it up into 2 phases. So for this coming week, January 23rd, 2020 through January 27th, 2020, the HIC this year will only focus on these questions: unit occupancy, bed occupancy, dedicated bed inventory, and specifically how that has changed because HUD has released new data standards for 2020. They were released in October 2019. This is a process for us to update our internal data to match those new data standards. And finally, we'll ask you if your project plans to increase in units or beds between now, during the HIC, and the next HIC, or February 2021, to be more specific. Individuals or projects who should complete a HIC, well, sorry, not individuals. Projects that should complete a HIC simply need to meet the two criteria below, or one of the two. The first is that the project verifies homeless status for eligibility. So an individual cannot enter that housing project unless the individual is homeless. Or two, if a project does have some form of mixed inventory type, maybe it's low income housing, so Section 8 vouchers, and units and beds dedicated to homeless individuals. If the majority of the units and beds in the project are dedicated to homeless individuals, then that inventory may also be counted as well. The various HUD project types that should be included or should submit a HIC are all types. So emergency shelters, transitional housing, and safe haven projects will all conduct their shelter counts on January 23rd, and the data that they collect should then match or mimic their HIC inventory submissions, their survey submissions. Projects that are joint transitional housing and rapid rehousing projects, the joint component will complete a shelter count, and the rapid rehousing the joint will complete the shelter count and the HIC. The rapid rehousing component of the project will only complete a HIC. And then all forms of permanent housing, so permanent supportive housing, rapid rehousing, and other forms of permanent housing, such as housing only projects or housing projects with services but may not have disability requirements. All of those projects must also submit HIC surveys. The simple answer to how many in the due date is that we're looking for approximately 290 projects to submit their housing inventory counts to us by January 27th, 5 p.m. Yes, that's the simple answer. Sorry, I'm a little foggy today. So moving into the actual survey itself, it's set up of 4 major sections. So we've talked about these before, but it's the unit occupancy. So how many people were in, or how many units had people in them the night of the count. Bed occupancy, how many beds had people in them the night of the count. Dedicated beds, which is that new data element that we're going to update with this process that I talked about a little bit earlier, but I'll go into more depth when we get there. And then any inventory that's developing in the next calendar year effectively. So if a project will have a new grant where you have more beds and units, or you are able to talk with your coworkers or colleagues if need be, and they can say that they know more units will come online or more beds will come online before February 2021, you'll provide that data at that point. So the actual survey. So as many people are familiar, if you've done the HIC before, we have a login process that allows us to match your response with your project data. And we're using a similar login process for the HIC this year. In the pre-HIC, we released what was known as the HMIS 2020 pre-HIC reference report. We will have a similar report hosted on the help desk of HMIS starting January 21st. The sheet will look very similar to this, where it will have 4 columns. And the 4 columns, they're not listed here yet, but they will be what is the project ID of the project itself, the provider name as it is listed in HMIS. The 3rd column, or column C, as most Google Sheets or Excel sheets look, will be the unit data captured during the pre-HIC, or what's on historical record here at All Chicago. And then the 4th column, or column D, will be bed data that was recorded in the HIC, the pre-HIC or has historical or is historical at All Chicago as well. This is our baseline effectively for your responses so that we're better aware internally of what the capacity of your project should be based on your previous responses, and we'll measure upon that information. So to further explain why this sheet is important is that, as you can see, these two arrows come up on the screen here, the blue one and the red one. There it is. These two data elements are the username and password for each survey. So the provider name, so in this example, the Franciscan Outreach Association Streets to Home Initiative Case Management Summary. That HMIS ID number, not the summary component, so Case Management 239, that is the username, and then the project ID, the 239 number itself, will be the password. So when you actually, in your web browser, go to log into the survey, the provider or project summary will be put in the username box or cell, field, that's the correct term. And then the password will be the HMIS project ID number. Some quick notes about this. You simply need to copy and paste the cell in, and then to be sure that there's no extra characters that were added by Excel, like a space, for example, you should really click on the box and make sure that the space is removed from the beginning or the end. You never really can tell or know what Excel or Google puts into that field. So once you copy and paste it in, just click on it and make sure there's nothing extra in there. And then all of that same can be applied, all the same ideas can be applied to the project ID. So make sure that it's only the 3 or 4 digit number, that there's no other characters. Some general helpful tips to navigate that Excel sheet or Google sheet, when it comes out. You can, in your web browser, hold down Control on your keyboard and press F. And what it will do is it'll bring up this search bar. And when you highlight a column in Excel, Excel or in Google, for that matter, in Google Sheets, if you highlight this column and then press that, you then can search that entire column for a key piece of information like a Google search. So I used the example of I wanted to find that same Franciscan Outreach Project. So I hit 239 in, and then it will highlight in this black box where that is. So I found it really easy. You can do that for your projects as well, rather than scrolling through the actual sheet. There may be projects that are not listed on the actual reference report by error, or it might be a new project in general. We have in the past used these dummy logins, as we refer to them. They are generic program or provider IDs and names and HMIS ID numbers. You would, after consulting or talking with All Chicago, you would use these to log in if you have an error or there's an issue with your project's original login information. And the new ES program would be what I would use as the username, and the 1000 project ID is what I would use for the password. So the first screen that you will interact with on the actual survey itself is a brief project information screen. It allows us to verify, if who you are filling out the actual survey. So when we conduct some follow-up, we know who to talk to. So please don't put your ED's name, or if you're the person who fills out the survey, make sure that you're the primary contact information. And then this also allows us to deduplicate anyone who uses the dummy logins as well. So there's 2 reasons to. Please also list a secondary contact. I know that this is a busy time of year, so some people like to go on vacation as soon as the beginning of February starts. And if you're one of those folks, especially ensure that you put a secondary contact so that we can follow up with them if we have any additional questions about your submission. The second screen that you will actually interact with is this. This effectively will ask you the simple question of, did your project serve anyone the night of January 23rd? And there are three fundamental answers. Yes, the entire project, yes, individuals, entered the project and became housed the night of January 23rd, or no, no one entered the project because the project was full the night of January 23rd, or no, no one entered the project and the project was not full the night of January 23rd. Now, regardless of which one of those those buttons you click, you will indicate how many people or how many individuals your project served the night of January 23rd. And this is especially important for projects of THES and safe haven model types. The number that you indicate in your transmittal form to DFSS should match the same number that you put here in question 2. So if I have a hypothetical emergency shelter project with 100 people in it that the night of the count, however their demographic breakdown is on that transmittal form, I think it's the top box, I would put I served 100 people. You would then turn around and put 100 number of individuals were in your project on the night of the 23rd here in question 2. So then moving on from this kind of like quick snapshot, and these two questions are really important this year to help us that ultimate goal I mentioned earlier of trying to move to this HMIS reporting like system. If projects accurately respond to these questions and we can confirm that on our end, that improves the likelihood that we can move to that automated HMIS reporting structure that we were talking about, rather than our office having to do a lot of follow-up and clarifying submissions. So that's more incentive, I think, for folks to consider doing this particular question or two questions as accurate as you can. You should do all of them as accurate as you can, but I guess just a little extra something for these two. So a quick note about calculations for beds and units and the methodology that we're using now. It's very similar to what HUD actually uses. So singles, families, and children only beds and units, those are the three major like household types that you might encounter or talk about, or the HUD wants us to talk about. It's the same how beds may be for only singles, they may only be for families, or they may only be for children. And when we're talking about children, we really are only focusing on 18 years and younger for these like inventory questions. Now, all three of those populations or groups put together is a total of something, whether that's beds or units. So if I have, in this example down here, we'll explain that. But I need to clarify one other thing, is that for the purposes of what we will be doing, the math for beds and units is always the same. You always will subtract the families and children only beds or units from the total number of beds or units in the following questions. So what do I mean by that? I mean that if I had a hypothetical project where we have 100 units and 50 of those units are for families and 0 of those units were for only children, that would mean that I had 50 family units minus 100 total units would equal 50 single units. So I had 50 units filled the night of the 23rd with individuals that are singles, so 50 people in those units. And then across my 50 family units, I have however many people would occupy those. But I would know that the families and the singles unit numbers like very clearly. So section 1 is about the unit occupancy itself. So when we talk about your total unit inventory, it will be the number that was on the reference report that you use to log in. And this, again, is either historical data or what was previously updated in the pre-HIC. And then the occupied units are the number of participants or consumers that were the number of units used by participants or consumers on the night of the 23rd. So in that last example of 100, I had 50 families occupied and I had 50 singles occupied. That would have meant that I had 100% occupancy. Moving into what the actual survey will look like. So this is another screenshot. So for this example, the first question asks, how many of the units listed on the 2020 HIC reference report were occupied on the night of January 23rd, 2020? So if we want to say that there were 40 units on the inventory column on the reference report, that would mean that I would then put 40 here. I had no vacancies, so the entire project was filled. If the entire project was not filled, you would indicate however many folks were in occupied units the night of. So if I only had 30 units occupied the night of, I would put 30 in this first field. If I had 0 occupied, I would put 0. Now, of the total number of occupied units, I'm going to list here how many of those units were households for at least one adult and one child, or families, as it's also known. In this example, of my 40 occupied units, 15 of those were for households with at least one adult and one child. And then I further go on to state that 0 of my units were for children only, or 18 and under. Oops, sorry. So moving beyond units, and a very important distinction to make at this time is that if you have units, if you have congregate living, where an example may be you have a shelter with, there might be 2 or 3 different households in one unit, perhaps. It might be like a single mother with 2 children, so that's like a family household. And then you have adults, by themselves in that same unit. Go ahead and list each of them on their own. And what I mean by that is that you would count the family unit as one, and you would count the single individual as one as well. So you don't want to count, you would count that unit number in total as 2, which would increase the number of units that you may have. If you go beyond the number of units that are listed on the HIC report, that's not a problem. Our office will simply just to follow up. We typically know where this applies into what projects, and we'll know who to reach out to. But if you have any questions at any time, you can email us. It's really hard to tell everyone how to do something one way, because the way the units and beds work is that every project almost has their own method of counting their inventory. And so we are working our best to translate basically between, what it looks like at your agency to like how to report it to HUD. So don't stress too much if your agency doesn't work inside of this cookie cutter build. Myself and Elizabeth Perez will work with you to get it figured out. So moving on to bed occupancy, it's very similar. Like I said, the math for both of these sections is the same. So again, you will reference that total bed inventory from the HIck HMIS 2020 or the 2020 HMIS HIck report. And then you will then report how many folks or how many beds were occupied by folks the night of the 23rd. So for this example, I'm saying that 70% or 70 of my beds were occupied. So I'm going to put a 70 up there. If I had 100 total beds and only 70 of them were occupied, I would put 70 here. If all of my 100 beds were occupied, I would put 100 here. Just to make that very clear. Now, of the number of occupied beds, how many of those were, how many of those were for households of at least one adult and one child, so the family type? I'm saying in this example that 45 of those beds were for individuals from a family household type, so folks that were either adults and children but together in a household. And then for this example, furthermore, I'm saying again that there's no children-only households. That data point will be rather rare. We don't have very many beds and units dedicated to minors in the system, but they are out there. So moving into of all of the new stuff, the most new and confusing part is this shift or change in how HUD wants us to count dedicated beds. So historically, we would just ask you questions about the 3 subpopulation types that have dedicated inventory for them. So chronic homeless individuals, veterans, and youth. But as of October 1st, 2019, that data point or data standard, is effectively different in the way they're counting inventory dedicated to these different folks has changed. And it's gone from these 3 buckets you could think of to 7 more specific components or inventory types. So the first one is chronic homeless veterans. The second is youth veterans. The third is any other veteran that may not fall into those 2 first categories. The fourth is a chronic homeless youth. The fifth is any other youth, and then it's any other chronically homeless individual. Sorry, there are 6, not 7. Projects that have beds specifically for any of the populations listed above will report those subpopulation dedicated beds when prompted, and I'll show you what that looks like. Quickly to note that if your project is dedicated plus, that does not automatically mean that your beds are for individuals experiencing chronic homelessness. They're no longer automatically classified as dedicated. These dedications are really coming from HUD guidance. They'll be contractually mandated dedicated beds, or dedicated beds that come specifically from specific funding buckets. So just to clarify. And this is rather new, so if you think this may impact you, do know that it's really kind of only for projects that are federally funded. So whether that be SSVF or VA funding or youth funding, so maybe RI providers, RI recipients, excuse me, and or projects that receive funding directly from HUD. But if your agency doesn't receive any form of federal funding, then this data standard or this question will be pretty straightforward for you. Okay, there we go. I thought it froze for a second. So the questions related to the dedicated beds are all relatively the same. There are these various boxes, and they're broken up into single individuals, and then households with at least one child and one adult, or families. And then we ask, by like bed type per the new data standard, do you have any beds dedicated for singles or families? So on the screen here, I have said that my hypothetical project has beds dedicated to chronic homeless and veterans. My project has 20 of those for singles, and none of them for families, and none of them for any other veteran types, but they are specifically only for chronic homeless veterans. Now, this same matrix effectively is reproduced across each of the population types. So as you see below, we have the youth dedicated beds. So again, it's the singles and individuals, and the families, and then the actual like bed types. So chronic homeless youth and or dedicated to all youth. And then the final dedicated bed type is individuals experiencing chronic homelessness. So we ask for singles and individuals, and we ask for families or households. Now, one major disclaimer or note is that if a household is all beds included. So if you have a family unit that is made up of 5 beds perhaps, and the head of household is, a chronic homeless individual, all of the beds in that household should be identified here. It's not just the one that the chronic individual is inside of, it's all beds associated with that household. That's a very clear distinction. When I post my slides, I'll post a copy of the slides as well. I will make a note about that. Our office is also working internally to draft like a one-pager about this, and there'll be more information about that to come soon. So the fourth section for the HIC this year, and the last one is the inventory and development. If your project's capacity will increase or increase between February 1 and January 31, 2020 and let me start that again. If your project in capacity increased between February 1, 2019 and January 31, 2020, your inventory will be considered as current. So we've captured that data effectively already in the pre-HIC process, more or less. Moving forward, any form of bed or unit that is added in addition to your current inventory will be considered under development or in development. And those are the beds that we want to capture with this particular question. So the way that we would capture this data on the next slide is you'll be asked simply, will this project have new fully funded beds and or units ready for occupancy by February 2021? And this may require that you sit down with maybe someone in a different department or part of a different team in your agency, if you're a large agency, who may have more knowledge about the strategic plan or grants management, contract management. Sit down with them, and to your best ability, if you think this may impact you, record that. If you think there will be no increases to your inventory within this time period, you would simply click no at the top. Our project will not have new beds and or units by February 2021. If you do click yes, just provide the number of beds and the number of units in the fields below. They'll populate, or not populate. They will appear by the logic of the question itself. So once you've completed the 4 sections, and then obviously some contact information, and then the kind of snapshot of your agency's occupancy the night of the 23rd, you'll see this confirmation page generated. My advice to all providers is to print that page as a PDF. Don't rely on the emails from Survey Gizmo. They are somewhat temperamental, and often if they do go through, they often end up in your spam or junk box. So I've just been advising everyone moving forward to really just control P or go to file and print, and then print that copy or that PDF. I think there's also a download button that you can click as well. That acts as your proof of submission, if you like to keep that as a record. If I or someone from our office emails you asking for your HIC submission for some reason, because we can't seem to find it in our data, which has happened, or I don't know, something else might come up and we just email out to you, you can send that to us as a proof of submission, and then that would be that. So, excuse me. If either of these scenarios occur, so I'm submitting a HIC survey for a new project and it might not be listed on the report, or it's a new project and I don't think the right information is listed. Without a doubt, the easiest way to get to the bottom of it is to email me at cocprograms@allchicago.org, or there is no or, actually, or call me. You can call me as well, but the email is more effective. I'm able to track it more effectively. And I'll know if you respond or if I respond, I won't lose it as much. And I'm just better about emails than I am phone calls. So I would advise that. And also I can access the email from anywhere. My phone is here at the office. Typically, if there were questions, we would ask for questions. If you have any questions about due dates, this is this information again. Each pre-HIC should be submitted no later than 5 p.m. on January 27th. Generally, I think this will be doable considering the length is much shorter than previous years. But if you don't want to move that, we want to get as many of the 290-ish survey submissions as we can by that day. So you obviously can reach out to me if you're having technical difficulties or if anything else comes up. Helpful tips. Review the PDF version that is generated. It will pull the data that you enter in, so if you see something is there that shouldn't be there or that's incorrect, you can go back and edit that. We strongly advise to have this information maybe in front of you or to think about it ahead of time. That way you don't have to stop and get up and pause. You can just kind of power through. If by chance you do need to save and return or come back to it at a different time, on the next slide, I will explain the save and return option for Survey Gizmo. And then again, any questions at all, please feel free to contact our office. The cocprograms@allchicago.org is the most effective way to get a hold of us. Another benefit to that is that many people in our office are able to monitor that. So if one of us isn't available or at our desks, other people are actively looking over that email and able to respond. Okay, so in your web browser, if we were to be filling out a Survey Gizmo in front of us right now in the this HIC webinar or recorded webinar, sorry, this gray line or box that says save and continue later would be at the top of our web browser, right below our search bar. This will be at the top of the 2020 HIC survey. What you will do is you'll click save and continue with your mouse, and this pop-up will generate. Ensure that you type in or copy and paste in your email address the same both times. And what Survey Gizmo will do is generate a specific link and send it to your email so that you can reference it and edit your submission at a later time if you need to. Additional resources. So this webinar obviously will be found on our website, but a copy of slides, and I've kind of tweaked them, and again, we'll have another additional tweak that I'll post on the slides so they're the most accurate and helpful as they can be on our website. If by chance you know someone who needs to do a shelter point training, so they need to enter data into HMIS for the night of the count, this article linked below is directly to the All Chicago, the HMIS help desk. This is only though for projects that are ES, TH, and safe haven types. If your work does not include any of those model types, then that training, you can take it if you'd like, but it won't necessarily help you. And it's not related to the HIC at all. One last reminder for emails or contact information. Again, the email address cocprograms@allchicago.org is the most effective. And then any HMIS related questions you may have, as far as data that's currently in HMIS, you can direct them to hmis@allchicago.org specifically. Thank you.